This is Dr. Sajid Maqbool talking about the appropriate use of prescribed medicines. A few tips. The first one is to understand which particular medicines have been prescribed by your physician, your pediatrician, and you must understand the instructions very carefully, which means how much to give each time, the measurement, and how frequently it has to be given. Also, the duration of the treatment must be kept in mind. It is quite all right for you to ask the doctor if you don't understand any of the instructions, rather than make mistakes later on. The medicines generally are prescribed keeping in view the condition of the child and also the age, etc., and the capacity of the child to be able to take the medicine. And in general, the principle is that medicines are prescribed only if not giving the medicines will harm the baby or make the condition worse, and giving the medicines will have a definite benefit. And similarly, the duration of the treatment is very important. Please don't try to alter this on your own. For example, give more medicines than has been prescribed, and do not change the number of days, either shorten them or prolong them, because that can also have adverse consequences. The other thing that you must also remember is that the particular brand of medicine that has been prescribed is generally done after careful consideration. That is, standardized medicines and from a reputable, known pharmaceutical company. And the doctor, of course, has thought about this and deliberated and then given you the medicine. The problem with that may be that if you decide on your own to change the particular brand or go to a company which is not authentic, or the medicine may not be up to a particular standard, then the desired effect may not take place. The child may not get better. Besides, there is also another risk, and that is, if you do this, then the medicine that you have decided to give to the child instead of the prescribed medicine may not only have no effect, but also may then cause resistance, which means that the same medicine, when used or when advised for another condition in the future, may not work. And this has become a problem for a lot of medicines. I have already explained to you the need for avoiding unnecessary use of antibiotics and other medicines in general. So please use medicines as have been prescribed by your doctor. You can discuss it with him, you can question him, but once the prescription is finalized, stay with the medicine that has been prescribed and stay with the pharmaceutical company that your doctor has selected very carefully. I hope that this information is of use to you. I'll come back to you with some more videos.